Dr. Pat, you are in luck because today is Fun Quiz Day on Uncomfortable Questions. So you've got three options you get to choose. Option 1, which prom dress is right for you? Option 2, which of these celeb icons is most likely to get canceled next, Hunty? And option 3, which of these last longer in bed techniques is your vibe?
Let's go with C.
Good, that one's not in the magazine. We can circle back to prom dresses later. Hey everybody, I'm Chad Callahan from HIMSS, and this is Uncomfortable Questions, where I ask a medical professional all the questions you are dying to know the answer to, but too embarrassed to ask. With me, we've got Dr. Pat Carroll, who is a board-certified family physician with over 3 decades of experience, and he's the chief medical officer at HIMSS. I am going to read off the techniques, and you are gonna give me the intel. Sound good? Okay, so Dr. Pat, first, did you know that Kegel exercises are linked to several improvements in sexual health?
I did, Chad. You know, a 2014 study showed 80% of the patients had gained control over their ejaculatory reflex using Kegel exercises.
And the things they teach us in gym class. Okay, so time for a tutorial. 1, take a seated position. Doing great so far. 2, make sure your bladder is empty. Please hold. Surprisingly informative articles, right? Okay, where were we? Identify pelvic floor muscles, tighten and count to 10. And then you release and give yourself another count of 10 to relax. Repeat this process for 10 repetitions, 3 to 5 times a day. So morning, evening, before going to bed. Tighten and release. Are you medically impressed by my Kegel skills?
Well done, Chad.
Thank you. I will take that as medically impressive. Onward! How many more do we have? Oh, we got a lot. We've got 9 more. I was distracted by Kegels. Okay, so we better move along. This is supposed to be a short video. Maybe we can combine a few. Let's start with the list of things that you can do when you are having sex.
You know, a good person to talk to about this may be a urologist.
I had a urologist once. Well, you're in luck because I called my best friend, Dr. Pete, my urologist, and I asked him what we should be doing, and here's what he told me. He said, when you're having sex, there's a few things that you can try to delay your orgasm. More foreplay, different sexual positions, changing things up. 3, the stop-start technique, AKA edging, wherein you have sex up to the point where you're almost about to ejaculate and then you stop. Seems pretty self-explanatory. And next up is the squeeze technique, where you get yourself right up to the edge of the ejaculatory response, and you physically squeeze your penis between the shaft and the head, which discourages the ejaculatory response. All sound good so far?
Yeah.
All right. So Dr. Pete also gave me a list of things that you can try on your own. So one of those is masturbating before sex. So this makes sense because if you masturbate, if you ejaculate before sex, the refractory period might help you delay ejaculation the next time you have sex. And visualization. So Dr. Pete specifically told me that I should think of something totally unarousing. For example,
doing your taxes.
You're not aroused by taxes? Maybe organizing your ribbon collection, distributing flyers for charity, things that are unarousing. Okay, what else can we do? I need 3 more to get to 10. Maybe there are some products that folks can use during sex that might help them last longer?
Yeah, absolutely. And HIMSS has these products. One is desensitizing condoms. The other is desensitized spray or wipes, which you can use.
Yeah.
And the last is medications.
So there are prescription medications that can help you with premature ejaculation.
Absolutely. So there's 2 different. One is the PDE5s, you know, the medications that help with erectile dysfunction, and the other are actually SSRIs, medication like a Zoloft or in that drug class.
So medications that we know as mental health medications can be used, what would be referred to as off-label, to help with premature ejaculation?
Yes.
All right, so we've got the full list. We've got 10. I'm gonna go through them all. I'm going to do all of these things to last longer in bed. 1, pelvic floor exercises. Start with some foreplay. Try a bunch of different sexual positions. Use the start-stop technique, some edging. Get a little squeeze technique in there. Practice my breathing while I'm visualizing very unsexy things. All the while I'm spraying my penis down with lidocaine, wearing a desensitizing condom. And during all of this, I am calling my provider to ask him about prescription medication options, yes?
Not all at once.
But Dr. Pat, I'm an overachiever. Thank you all for joining us. This has been another episode of Uncomfortable Questions. If you want more, please like, please subscribe, and the most important question, comment below which of these prom dresses is for me. Am I a Viva Magenta or am I a vibrant turquoise? Dr. Pat?
I'm a medical professional.